2.
Well, welcome back, everyone, to another segment here. And guess what? I get to talk with Dr. Tom Baudo, and of course he is from our Florida Eye Institute. It's so good to see you and a wonderful, satisfied, we always love talking with satisfied customers, and in this case a satisfied patient, Mr. Knisely. Good to see both of you.
Thank you.
Pleasure to see you again.
You know what I love, though, is when we do have this opportunity to talk with some of the patients, Dr. Baudo, that have such a story to tell. But before we do that, I know you're one of those wonderful eye doctors at Florida Eye Institute. What would you consider, what is your specialty?
Well, I am an ophthalmologist, and I'm fellowship trained in the disease of the retina. And that really, most of my practice is focused on macular degeneration and diabetes. And really in this area, predominantly macular degeneration takes up most of my time. And fortunately, fortunately for a lot of the people nowadays, macular degeneration, which is a disease that really robbed people of their central vision for years and years and years. Over the past number of years, we really have a great way to preserve vision. It's no longer that real threat, and it's not that disease that people are so afraid of where they know they're going to go blind. Most people, not only can we preserve their vision, but we could actually improve their vision.
Oh, is that not the greatest thing? I bet that was great news for you, Mr. Knisely.
Oh, it was a lifesaver. I was coming down from Pennsylvania a few years back, and all of a sudden the telephone poles were wavy.
Golly.
So I thought, well, I better go in and see my eye doctor. So I went in to see him, and Zoom, I was sent over to the Florida Eye Institute. And fortunately, as time went on, I didn't meet Dr. Baudo on that first trip, but about 2 or 3 guys later, I finally found Dr. Baudo about 3 years ago.
Isn't that wonderful?
And my eyes have improved, actually. I can drive, I can play golf, I can see the golf ball, I can read, I can do all the things that I like to do, but thanks to Dr. Baudo and his aides, they sort of preserved my vision.
It must have been terrifying, though, because I understand that when all of a sudden your eyesight really becomes a little messed up, from what I understand, if you don't have good eyesight, your entire psyche, your energy, everything is destroyed. So that had to be scary and terrifying for you. When you identify a disease like macular degeneration, is it, and I know there's a wet and there's a dry, is that right?
That's correct.
So what is the new, I mean, every day I hear some wonderful new innovative ideas that have come about with our medicine, with eye care. What is it that you diagnose, and what are some of those new treatments that Mr. Knisely has enjoyed?
Well, I saw Mr. Knisely first back in 2009. And at that time, we were using Lucentis. And all the treatments that we have really are treatments for the wet macular degeneration. And wet macular degeneration is the disease of that center part of the retina, the macula, responsible for your central vision. And they call it wet because there is bleeding or leakage underneath the retina. And the blood forms under the retina, causes vision to be distorted, blurred. A lot of people have a big black spot in the center of their vision if it goes on long enough. And when Mr. Knisely first developed it, we started treating with Lucentis. Lucentis was really one of the first breakthroughs in the treatment of macular degeneration. And we've been treating him with Lucentis now for a few years. And Lucentis does an amazingly good job, and I still use it on a lot of patients, even though there is something newer out. And the newest treatment is called Eylea.
Eylea.
Now, and the big advantage of Eylea, all these medicines block a chemical in the eye that causes this bleeding and leaking. These really were started as medicines that were used to treat cancer by shrinking the blood vessels for cancers and trying to shrink them down. And some very smart people a number of years ago figured that if you inject these in the eye, you can actually stop these blood vessels that are growing and bleeding underneath the retina. So that's what we've been using on Mr. Knisely, this Lucentis, up until just a few months ago when Eylea, a newer medicine, came out. Now, the people who are sort of knowledgeable about macular degeneration, waiting for something newer, because the goal of these treatments is not only to be successful in preserving their vision, which we have been, but now we're also trying to extend the intervals of treatment and make people's lifestyle a little better by not being seen quite as frequently. And this Eylea is really the first one to extend the intervals from 4 weeks between treatments, now has the potential to get up to 8 weeks, and that's really what we're shooting for with Mr. Knisely, to extend the interval.
Oh boy, that has to be thrilling too. That means you can get out there on the golf course, right? A little
Well,
more
that's
frequently.
true. Plus, you know, it goes like if you have it every month in this eye and then this eye, and your schedule plus the evaluation periods.
Sure.
Every
Takes up a
week
lot of
you
time.
have something going on. But with this new Eylea thing, it's going to free more time for me.
Yeah.
And you know, I'm kind of used to eye problems because as a child I had 2600 vision.
Oh,
So
my goodness.
all my life I wore Coke glasses.
And you don't now.
I learned to cope. But then when this problem came along, I thought, wow, this is a new one.
Sure.
But thanks to Dr. Baudo and his institute, they have done a marvelous job.
But that is so encouraging to hear as well. Now, I know that every time, I know Dr. Zudans and you, Dr. Baudo, when you talk to me about some of these procedures and you talk about a shot in the eye, I go, oh, you got to be kidding. So tell me, honestly, Mr. Knisley, does it hurt?
No.
Okay.
The first time was kind of traumatic because an idea of a shot in the eyeball.
Yeah.
But after that, it's there's almost minimal pain involved. And just you see a puddle of liquid in your eye. And
Sure.
That's it.
Yeah, just like drops or something.
And with Dr. Baudo, it's 1, 2, 3, you're done.
That's
like
true.
that.
I have it all.
That is so great because I think that is a fear because there's something about so sensitive about your eyes.
Yeah, the first time people have the treatment, I tell them, don't worry, this will not be bad. It's going to be a piece of cake. I said, you're going to worry all night, but I promise you afterward, you're going to tell me I was right. And almost universally, people say the same thing, that it's not that bad. But anybody, human nature, you're going to be worried when you hear that. But it really is nothing to be afraid of, and the ability to preserve your vision.
Well, Thomas Baudo, I can tell you what it is just a wonderful thing to know that our Florida Eye Institute has such fabulous doctors and such a wonderful opportunity to meet one of your happy patients. And Mr. Knisley, tell me though, when do you get back on the golf course?
When did I?
When are you getting back on the golf course?
Monday morning.
All right.
I would be there today. But
I wanted to hear that.
Him not being there.
I was going to say you had to come in with Dr. Thomas Baudo, and of course, if you're looking for one of those fabulous physicians at Florida Eye Institute, remember this is something that I think everyone should be aware of. That there is something that can be done to make that eyesight a lot better.
Can I just interject that
Sure.
the staff he has over there are tremendous.
Are they?
Go in there, everybody, I walk in, Mr. Knisley, how are you? Mr. Knisley. I mean, wonderful people.
Isn't that great?
He's done a great job.
And you didn't get that up there in Pennsylvania, did you?
No, I did not. In fact, I've gone in Pennsylvania to a doctor up there, but the atmosphere and the people, it's
I love
entirely
it.
different.
I just love
We
it. Hearing
appreciate it.
somebody who really loves
Mr. He's a great guy, and I appreciate it.
It is fun too, and I know you love what you do as
Yeah.
well, Dr. Baudo.
Thank
We
you.
want to thank both of you so much for coming on. I'm going to see you out there on the golf course and maybe a hole-in-one next time.
Well, I'd like to get another one.
Yeah.
I had one.
Oh, good. All right.
I'd like to get another one.
It's
Try
amazing.
to get a few more, get the vision a little bit better.
Absolutely. Thanks so very much for being with us. Florida Eye Institute, ladies and gentlemen, when you want to meet a really wonderful, wonderful staff and, of course, a great doctor, Dr. Thomas Baudo. Thanks once again for being with us.
Thank
And
you.
we'll be
Thank
back.
you very much.
Stay with us.